Welcome to this session about volumetry. Volumetry injections are boosting the market for a few years, as well for local treatment, as well for aging treatment. We're going to speak about this. The indication, also the way it can be improved with combined therapy, and also the limits of this volumetry revolution. We're going to speak about this with Dr. Hema SUNDARAM. You're a dermatologist in the United States. Hello. Medical master degree in Cambridge, England, research fellowship at NIH, and you wrote a book lately about beauty and aesthetic, very interesting. Dr. Benjamin Hacher, you are the course director of the IMCAS and a plastic surgeon in Paris, and you're going to speak also about all this volumetry issue. First, maybe just having an overview of the indications for volumetry. Indication, I said, in local treatment, in aging treatment also. What are the main indications for aging treatment, Dr. Hacher?
It's typically when you lose your fat. So it's a mode of aging. It's not the unique mode. It's mainly dedicated to the temple, some halo surrounding the orbit, the mid face, and very important, the lower face. And the most part of the time, you need to deal with that, even if you have other problems.
It's the natural aging process.
It's one. With the second measure is the sagging. So the most part of the time, or you have a dominant of the lipoatrophia, or you have a dominant of the sagging.
So for these two, you can go to volumetry.
Just for the low, meaning the loss of the fat. For the sagging, absolutely not. We need to make an elevation, and the most part of the time is a surgical problem.
The other indication is for local treatment, where it's not about aging. Is it's increasing indications also? Is it maybe doctor? Can you speak about these indications?
Yes, I think that the main reason we're using volumetry is for addressing the aging process, as Dr. Hacher so nicely described. But increasingly, we are seeing younger patients who are not experiencing significant volume loss, who are coming in for augmentation procedures. And classically, this has been for the lips, but now we are seeing it also for the malar region, for the cheeks, and even for the forehead, especially in some populations, such as Asian populations.
So
and I would say, also, but I'm sure she's a specialist, but for the nose.
And
the nose is a wonderful new area to explore with the volumetry.
Volumetry is going with different techniques, actually. What are the most efficient technique for it? For you?
Easy, we go the most part of the time with a long blunt tip cannula, because it's the most part of the time the ideal technique, and we put a sick product, not a sicker one, but probably a good product with quite sick.
And you what product or techniques do you prefer to use?
Well, what I've evolved towards now is a multi-plane technique, otherwise known as the sandwich technique. And I like to really make use of the scientific properties of the fillers. So if a filler is firm, as Dr. Hacher said, or thicker, it will have good lifting capacity. We measure this scientifically as G' or elastic modulus. These fillers are very suitable for placing deeply, and a blunt cannula is a wonderful and safe way of placing those fillers. I also very much like to place fillers on top of that superficially. This is a kind of tension volumization within the dermis or just below the dermis. Those products ideally will spread more. So they should have a lower viscosity, and they do not need to have as much lifting capacity. They can be lower in G'. For those, I'm tending to use a sharp needle. I like to combine a long sharp needle, maybe even 1.5 inches, 38 millimeters, for the superficial volumetry to track through the dermis.
The sandwich.
I agree totally. We say, sorry for that, it's you probably the American touch plus the French touch. And we are absolutely on the same line.
The sandwich technique
balance
is very
between the two levels of injection, one deeper than the other one with quite a sick product, and another one with a classic product.
One thing is about the quality of the skin that can be improved also by volumetry. It's not just about volumes, but it's also about stimulation of the skin.
Absolutely.
As a dermatologist, do you view this as a real asset for the technique.
Absolutely, and it's very important to explain this to patients so they understand that the effects of volumetry are not just temporary, but they are getting long-term benefits. And from the deep fillers, what we see is collagen stimulation, which results in a more long-term volumization of the face, improvement in facial contours. When we inject superficially, we see an increased skin radiance or a boosting of the skin's appearance. Even the pores can become less prominent. So when we put those two effects together, we get a very nice synergy and an overall rejuvenation for the patient.
So this stimulation is a real improvement for rejuvenation of the skin.
It's dramatic.
It's dramatic.
But let's speak about another stimulation. We have not to forget that the number one volumizer is the fat. And volumetry is much more on the hand of the surgeon. There is another point concerning the fat, meaning the lipofilling. The lipofilling. And men now is probably one of the most important indications all over the world. In any country we have that, lipofilling is growing. Why? Because first, it's a major volumizer, and point two is that there is a natural stimulation from the hormones which is going to ameliorate, of course, the surface. That's the point.
Is it depending on the patient's wish to go for a lipofilling or an injection for sometimes, or is it, how do you do the choice?
I think we have not exactly the same mode to deal with that, meaning that when I'm operating, when I make a facelift, I'm on the good condition to take out the fat and, of course, to take care everything from, let's say, the surgical point of view. But when we are inside, let's say, just, the office, I think that, and for the people who don't want and who want any surgery, definitely the HA and the filler are probably the best.
Although I certainly do perform autologous fat transfer as well and lipofilling. And the way it fits into my practice is I think it's my responsibility to inform my patients of all the different options. And we also have now platelet-rich plasma, platelet-rich fibrin matrix as well. And then with the patient, I work cooperatively to figure out the best plan. I will tend to use lipofilling for patients who need maybe more than 7 or 8 cc's correction, and very often I will combine it with HAs or even with calcium hydroxylapatite or some of the other volumizers. I think it's a very interesting concept also to combine lipofilling with platelet-rich plasma or platelet-rich fibrin matrix.
So it's really going to combine therapy to
Yes.
improve it, actually. It's what you call a step-by-step revolution in a way.
Yes, because, it's not something that we have just to deal on just for one time and it's finished. It's something that, we maintain. So the most part of the time, we make a first step with, let's say, a basic and good average concerning the fact that we feel on a good conditioning. Then, of course, we maintain the result with additional either HA, either fat, and more, it will work. Meaning that 1 + 1 is not 2, it's 3.
But there's some patient who need surgery for volume.
Of course, when you have a major sagging, so if you have a halo, if you have any loss of the volume, definitely is, we say, the volumization. But if you have a dominant or combined aging process with a sagging, you need an elevation. And of course, it's on the hands, thanks for that, of the surgeon.
One thing very important is the limit of this revolution. Limits is not the good name, actually, the good word for it. But because volumization is a way to have a vision of the beauty of the person, of the equilibrium of the face, actually, and the body. There's something called the balloon effect, which is scaring a lot of patients. How to avoid that? Is it a real problem?
From both parts of the Atlantic, we don't like the caricature. And we don't like, the too much patient. And when you would like just to resolve, all the problem with just the injection, you balloon. And balloon is so ugly, it's absolutely not something that we are looking for. We are looking for the natural appearance, the natural look. I would say the French touch, but she will say the Washington good touch.
In America, we call this the big head syndrome, when the patient has a very thin body and then has a face full of fillers and the head is much bigger than the body.
You speak about another issue, very important, is you call it the filler gap, actually. The fact that it needs to be really explained. It needs to be really shared, actually.
Yeah, so the filler gap is really the distance between how much volume the patient needs and how much volume the patient is willing to have. And there will be a gap there for different reasons. One is budget, how much money the patient can spend. Sometimes it's philosophy as well. What I find is I have to counsel, I have to advise my patients, because sometimes they come to me and they say, well, fillers are temporary. Give me something that's permanent. And then I have to explain to them that firstly, nothing is permanent because the aging process continues. And secondly, that fillers are increasingly longer lasting if we use the techniques that Dr. and Asher are talking about, the sandwich technique. If we combine fat with HAs, CAHA, maybe platelet-rich plasma and platelet-rich fibrin matrix, we can get greater longevity for patients. And the results are truly beautiful. I also wanted to mention when Dr. Asher talked about 1 and 1 equaling 3, this is what I call aesthetic synergy. And it is very important to understand that patients who have skin laxity need to have the facial envelope lifted and tightened before it is filled. Otherwise, if we take a loose facial envelope and we try and fill it, it's like filling a sock. The sock will sag. We can do this non-surgically in the appropriate patients through techniques such as micro-focused ultrasound, bipolar radiofrequency. These devices penetrate to the deeper tissues and can be effective for some patients who don't want surgery.
There's a real combination of therapy all the way, and there's a real shared responsibility and involvement in this volumetry treatments, actually. Thanks a lot to you two, and maybe coming next year for some more news and innovation about volumetry. Thank you.
Thank you.
Thank you.